So I would really like to welcome everybody here for the presentation. I'll just move that aside. Yeah. I'm very, very pleased to have Rhiannon Evans, who is based in Decipher with us, and she's going to do a presentation on how might schools influence students' self-harm and suicidal behaviours. We know from talking to schools that this is a real issue in schools, so we're delighted to be able to feature this within a webinar. And as I say, there'll be time to do some discussion, and then just a little bit of time to sort of update everybody on network news. So I'm going to hand over to Rhiannon, and obviously we'll be stopping twice to do some discussion and questions. So if you want to type your questions in, you can, otherwise save them and you can sip your tea.
Before we go, so hi, so for the third time I'm Rhiannon Evans, but just to point out that that's my email address, so if you had any follow-up questions from today, then please feel free to get in touch with me, or if there was some discussion points which you couldn't really convey through the technology we have, then please do let me know. So as Joan said, I'm going to talk to you about how schools might influence students' self-harm and suicidal behaviours. So there's three things I'm going to touch on today. So the first is trying to really understand the role of schools in those behaviours and the processes that lead to those behaviours. And then trying to think then about, well, what is it that we as a research centre and in collaboration with the Shared Network can do about this? So based on some work that we've done and work that we're trying to move forward, exploring opportunities for prevention within Shared. And then thirdly, and it's slightly more tangential, but I think it really contributes to the programme of work that we're trying to undertake, is the WISE study, which is the Wellbeing in Secondary Education study that we've recently been funded and are due to commence in January. And that's orientated to creating a positive school environment. So not explicitly self-harm and suicide, but leads within that programme of work. So just to start by kind of giving a little bit of background context about self-harm and suicide. So community studies in the UK have been conducted, and although they're quite old, and actually no community studies being conducted in Wales, it's in the other 4 countries, we know that prevalence of self-harm in secondary schools ranges from about 7% to almost 19%. And suicide ideation, which is termed thoughts of suicide or inflicting death on self, is reported to be about 16%. And this is sort of really important because we know that a third of adolescent ideators actually go on to make an attempt on their life. And recent evidence from the USA reports that about 5% of secondary school people will attempt suicide. And I think perhaps one of the most shocking statistics that people often use is the World Health Organization last year had their report, and suicide was the second lead cause of death globally in 15 to 29-year-olds. And that kind of needs to be treated with caution, because actually there's not that many other causes of death in this age group. So kind of like, don't read too much into it, but it does mean that it's still really important. And what we don't really have is a lot of international reporting about suicide in under 15s. The UK has only recently started a register, but the US do capture this data. And in 10 to 14-year-olds, suicide is the third lead cause of death. So, I mean, it is a pretty significant public health problem. And we also have a lot of underreporting. So as you can imagine, there is a tendency for coroners to not want to determine a verdict of suicide in children, due to a lot of discussion really about, well, can a young child have intent to die by suicide, and would it just be an accidental death? So there's a lot of debate, which I won't go into too much, but it's kind of worth thinking about is, well, why is it that I'm talking about self-harm and suicide to date? And kind of, do we need to think of them as part of the same problem, or should we be separating them out? And actually in the US and a lot of other countries, there's been a shift to think about self-harm as non-suicidal self-injury. So if you do any research or read any research, you'll often see NSSI. And however, I think in the UK, this is seen as being problematic due to the link between self-harm and suicide-related outcomes. So, for example, self-harm is associated with suicide ideation, and also self-harm in adolescence predicts suicide in later life. So in the UK, there has been calls to see them as part of the same continuum and kind of part of the same trajectory and journey, that although you might think something to be quite a superficial self-harm in childhood and adolescence, actually it can be symptomatic of later problems. And I've just kind of reiterate the point there about, well, what do you think about it being a continuum? And I guess for you to reflect then on how your school might understand self-harm, and just given those associations, do we see it as something meaningful that we need to be engaged in? Or is it kind of, people often discuss self-harm as being inauthentic and superficial and lacking severity, so it doesn't need to be treated as necessarily problematic. So trying to move on then and think about, well, how do schools impact students' health behaviours? And I'll just talk a little bit broadly about health in general, such as tobacco and substance use, pregnancy, etc. So there's been quite a bit of theoretical work recently. So this paper, which will be freely available by Farah Jamal and some colleagues here, was looked at, well, how do schools impact on students' health behaviours? And they offered a number of theories around this. So firstly was this idea of young people's identity work and need to adopt tough identities. So we see adolescence as a period where young people are forging identities for themselves, and sometimes when they're kind of positioned out of ideas of success within schools, they can try and create alternative identities for them, and this can often be a tough identity, which engages in substance use, alcohol, smoking. But also we have to recognise that schools can be a challenging environment for young people, that there may be bullying, etc. going on, and some young people might adopt these behaviours in order to survive within their peer group. Also, they talk about unowned and unsupervised spaces. So more traditionally, this would be seen as kind of smoking behind the shed. But basically, there's unregulated spaces in schools where teachers or staff might not be present. And when you have a group of peers congregate together, maybe at break time or lunchtime, that might lead to or facilitate engagement in these sort of behaviours. And then one of the key things here, and I'll kind of touch on this theme throughout, is about relationships between staff and students. So we know that when students are engaged in school, they feel part of the ethos and they're kind of drawn into the norms of the school. They're more likely to engage in positive health behaviours. But also when students trust staff, when they feel that they have meaningful relationships with them, when staff are delivering health messages, such as PSC, young people are more likely to be receptive to that and take on the message. And then fourthly is just the idea of escaping school, which probably seems self-evident, that school can be challenging, it's filled with challenging relationships, academic pressures, and substance use, smoking, etc. can just be a form of escapism for students. So we can kind of see an emerging set of theories then about, well, how is it that schools might influence students' health? I'm trying to move now more into what we know about self-harm and suicide. So a colleague of ours, Judy Kitchener at Bristol, has been working with the Avon Longitudinal Study of Parents and Children, also known as ALSPAC. So this is a cohort study, so it just follows young people across the life course and measuring a range of health outcomes and behaviours. And a recent piece of work she did, which some of you might have actually seen her present on if you'd come to the GW4 event, was that self-harm at age 16 was associated with the previous factors. So not getting on with or feeling accepted by others within school, not liking school or classwork, and feeling that teachers are not clear about behaviours and fail to consistently address misbehaviour. So this kind of sense that you're unfairly treated, that other peers might have advantages over you in terms of how they are treated by staff. So I'm just going to have a quick drink. So now moving on to a piece of research that we've been doing this summer, was trying to kind of map what Jamal and all had done more broadly around health and really focusing on self-harm and suicide. So we tried to review qualitative research in quite a systematic way to think about how is it that schools impact self-harm and suicide. So unfortunately, there wasn't much research, and actually the quality of the research was quite poor. but we forged on nonetheless. So we actually only had 9 articles in the end, which reported on 8 studies. So now you're going to see a minor type error on my part. So the studies, it's actually 3 of them were from Australia, 4 from UK, 1 from Canada, and 1 was from Hong Kong. And of these, 1 reported on suicide, and that was a study from Hong Kong. So actually what I'm going to talk about now is much more related to self-harm, as it was a culturally very distinct study, which I'm not sure would be that useful to us in the UK. And then 8 reported on self-harm, and 7 of them were in secondary schools and 2 were on primary schools. And both of those primary school studies kind of came from the same authors. So we extracted the data from the studies and tried to reanalyze it and tried to generate themes, really, which kind of tried to give us insight into, well, how is it the schools influence these behaviours? Wrong one. Yeah. So the first theme we had was about the invisibility of self-harm in schools. So this kind of feels a bit surprising in many ways, because we talk about self-harm a lot, and even in the Share network, people are always saying self-harm is a major issue that they are dealing with. But what the research was sort of telling us was people saw self-harm as a problem, but in much more of an abstract sense, that they knew this was something that young people were doing, but they didn't necessarily connect that with what they were encountering every day within their own school environment. And so studies often discuss behaviours that were hidden by their students, unaware of by the majority of the staff, and really undefined by the curriculum. It just didn't really feature. And this was one of the quotes that we'd had. So it's like anorexics and bulimic behaviour. Yes, I think people have always done that, but we didn't necessarily identify that. I mean, certainly one of the teachers in my department knows an adult who has psychiatric problems and she cuts a lot. It's something that people keep to themselves. It's not something people talk about. And actually, I think the evidence that this is true about this invisibility is a couple of studies asked school staff to estimate the prevalence of self-harm in their students, and they significantly and systematically underreported it. And a lot of that is linked to, well, what behaviours constitute self-harm. So for a lot of staff, it was the more extreme end of cutting, and cutting maybe to the point where the bone was exposed, and more low-level behaviours such as acting out, maybe issues around eating, under-eating, overeating, which may be defined as self-harm or intentional harm to self, didn't really fall within the remit that how people understood these behaviours. And I think in terms of more tangible manifestation of this invisibility was it was often undervalued or omitted from mainstream curriculum, despite young people routinely saying that they wanted to talk about it. So there's a couple of quotes here to illustrate that. So self-harm is attention seeking, but it's because of depression. We're not taught about it. We need to know. The school doesn't want to admit it. Cutting is attention seeking. It's normality now. So it's this kind of sense of, for a lot of young people, it's so normalized. This is something that young people do, but we're just not really exposed to about it in school. And I think quite interestingly, a second person says, there are posters all around school for smoking, but then there's nothing for counselling or anything like that. In my school, there are more people who actually self-harm than smoke or drink, have an assembly about self-harming. And I think that really resonates with what we're seeing in trends in young people, is that a lot of traditional health behaviours, maybe such as substance use or tobacco, are actually in decline. But self-harm and mental health problems and well-being actually seem to be on the increase. And young people are picking up on this and are responding by saying, well, why is our curriculum not really accommodating this change in our health needs? And then thinking then, well, what are the implications of this invisibility? Well, I think we have a sense really that there are discourses, often for young people in particular, around shame and stigma on self-harm and suicide. And we know this, that young people often don't seek help for their behaviours. They don't want to discuss it, particularly with adults or professionals. And when we have institutional investment in the marginalisation of these behaviours, by not making it present within the schools, it can perpetuate secrecy and reticence to seek help. So we can see an escalation in behaviours because young people aren't necessarily having the help that they need. And I think it's important not to be too critical about schools about this. And actually, the research was saying that staff are keen to bring these behaviours to light, but there is a fear associated with some of this. One of them is about contagion, that if you mention or talk to students, it will put ideas in their head and it will encourage them to do it, either by telling them about the methods that are available or showing images of the type of harm that young people do engage in. And also, I think more in terms of a safeguarding issue, invisibility could be accompanied by a desire not to open up discussion, because schools were concerned about being blamed for self-harm in the event that a child maybe attempted suicide or engaged in serious self-harm, and the parents found out that it was then spoken about in school, and that was seen as a trigger event. So the second theme, this is probably slightly more complex and tenuous of them, is the intersection of self-harm behaviours and educational priorities. So just to kind of foreshadow this a little bit, so when school staff were asked about how they understood and interpreted self-harm, there was a range of understanding. So this came from a very empathetic interpretation of it being an expression of young people's pain and a coping strategy, to more negative understandings of it being attention-seeking, often to get out of doing things. Maybe if they didn't want to do schoolwork, they might harm themselves just so they didn't have to do it. And this was seen as requiring censure and punishment. And what we saw was actually when classes or teachers, understandably so, were focused on delivering their curriculum, if a young person's self-harm disrupted that, it was often constructed as being bad behaviour, and it's disrupted other students' learning, and their behaviour was not in adherence with school rules. And so in those situations, and rather than it being interpreted as an instance of self-harm, it was interpreted as an instance of bad behaviour, and the individual was often denied support, and they were treated with punishment instead. So they were sent out of the room, and they were called disruptive. So as this quote shows, they said, well, I think most of us experimenting, but you probably get the odd child who, there's a bit of peer pressure there to be, I don't know, showing off sort of thing. So that sense of if they were showing off in the class by self-harming, they were punished rather than given support. So as an extension of this, I'm thinking about the structures really of schools and educational priorities. Some of the studies talk about school staff working in an environment driven by standards and progress. So this is something which has increased with sort of neoliberalism in the last 20 years, about standards understanding of education. And self-harm doesn't necessarily fit with those understandings, because self-harm journeys aren't necessarily done according to a linear trajectory. So you might not self-harm and then you're treated and then you stop self-harming. You can move in and out of being a self-harmer across your life course. So actually a lot of school staff felt quite disempowered and lacking competence if they tried to help a student. That young person had seemed to stop self-harming, but then return to those behaviours a few months after. It just didn't really fit with the nature of schools and how schools are driven towards constant improvement. And actually what that could lead to then is a reticence to offer continued support or to help the next young person, because they were concerned, well, maybe they weren't making meaningful change, and that young person might revert to those behaviours in future. So the third theme, and I think might be most interesting to some of you, is school management strategies, and how do we understand the impact of how schools manage incidents of self-harm. So I think there was a universal sense, and having spoken to a number of people in the shared network, this might also be true, that school staff felt insufficiently trained or had inadequate time to offer support. And I don't mean this negatively, but schools said that teachers often didn't want to know, or they were very keen to refer the student on because they wanted to relieve the burden. And there was very much this focus on, we need to find an expert who knows how to manage this, who knows what to do. So one quote said, it's this panic. As soon as someone says, I'm doing this, it's like, I feel some sort of panic. Oh my God, what are they going to do? Oh my God, And it's all like, let's quick, blah, blah, blah. Let's get someone, let's find someone, let's do something. And the second one then is, well, there are teachers who have got an awareness, I think, but I've got to get rid of that. I don't need to hold on to that right now. I just want someone to help this young person. And that's a totally understandable human response. And that is understandable, but schools often engage in what might be called an escalation approach, or what some termed an up and out approach, where if a teacher found out that a young person had been self-harming, their strategy was to escalate it through the hierarchy to the head teacher, and then the head teacher would then search for external experts. So it might be someone from CAMS, and they were brought in to treat the child. But actually what students often describe this of is Chinese whispers, of everyone in the school was talking about what they were doing and their harming behaviours. And this just doesn't really fit with what students want to do within schools, because actually they want to talk about their self-harm to teachers and the reasons which might have led to it. So one person says, year head and the deputy year head, they've been very supportive because you can go to them at any time and they'll sit down and they'll let you talk to them. But actually often due to that sense of teachers maybe wanting to find experts and relieve that burden, they felt the staff were often reluctant to engage in discussion. So I never told them that I self-harm. I did tell them that I was depressed and I'd had these suicidal thoughts, but she never said anything. She was like a nurse. If I had a broken leg, I'd go straight to her for a bandage or whatever, but she never said anything. So they felt the staff were often reluctant to engage with them. And actually this led to then a reticence to disclose those behaviours in future. They felt they didn't have a supportive school environment, but also if they were to disclose, it would become a big drama, everyone would find out about it. And so it made them retreat into themselves more. So the fourth and fifth theme are much more straightforward. So understandably, theme 4 was the pressure to perform. So it just taps into this notion that school is very stressful for young people at times, and it can cause anxiety and stress. So one person says, well, I don't think I'd be very surprised to see a primary school child who started to self-harm, purely and simply because the work was too difficult in school, or because they were having some problem in school. And both primary, second and secondary settings were seen as increasingly places where young people were self-harming. And primary settings is quite interesting because there's been a shift there. A number of studies for a long time thought children in primary school maybe didn't have the understanding to engage in self-harm, but that's no longer true, I don't think. And I think I touched on this earlier. Is that mic still all right? Yeah, sorry, sorry, I was just checking. So it touched on earlier, the school staff were generally seen as being sympathetic, but on occasion, they did understand self-harm as being an attempt to manipulate the situation, to gain attention, and just trying to distract from schoolwork because the young person either found it challenging or just didn't want to do it. And the final theme that we picked up was around tensions and negotiations within the peer relationships. And a lot of this, or the research around this in particular, has moved to online communities and how young people interact online. But I think there's still really a role for understanding peer relationships within the school setting, as a lot of bullying still happens here. And we see this kind of intersection between online and in real life, and things very easily transition between the settings. So I think there's probably still a role here for schools. So some studies talk about bullying being a trigger for self-harm. So one person says, being bullied was bad in primary school, but it's not as bad as high school, but it's still bad. It's really hard for me to stand up for myself. I didn't really stand up for myself. I don't think I have the confidence. So then I always used to keep it in. So for them, self-harm was a way of coping with being bullied. But also, on the other end of the spectrum, we kind of see students engaging in self-harm as part of initiation processes for entry into friendship group. And there is kind of a thread of research which looks around youth subcultures and behaviours that are associated with subcultural groups. So there's quite a bit around listening to goth music and being part of a goth subculture, where these behaviours are kind of intrinsic to the identity of those groups. So we might see something similar happening within schools and particular types of friendships. So this one people say, well, lots of kids do it because others do it first. They do it for acceptance in a clique or social circle. They do it for coolness. And we can kind of think more broadly also about self-harm here. So it might not be the traditional cutting. It might be excessive substance use or alcohol use. And those things have a clear gender dimension as well, which are kind of worth reflecting on. So in terms of some of the conclusions from that study and what we can think about is that schools often recognise that self-harm and suicide, although that wasn't as present in what I just said, can be a problem in schools, but they might render it invisible. And this is often due to them only really seeing the most severe behaviours. And I think the upshot of this, and the biggest problem of schools not really seeing it at the level it perhaps needs to be seen, is that when we allocate resources, this is one of the area where we don't have sufficient resources dedicated to it. And associated with that then is staff are often not offered adequate training about managing those interactions with young people they see on a day-to-day basis. And a lot of people spoke about an intervention landscape of we're working in the dark. And just because they're not trained to do it doesn't mean the school staff are not having to do it. They are doing it, but they just don't have the training for it. And I think there's kind of an interesting discussion about intervention in this area, is that some people have said to me that, well, if we train school staff to manage self-harm, we're just giving them more work to do. But I kind of think, having spoken to the people we've spoken to, is that sense of, well, they're already doing it, so we need to support them better in carrying out these interactions with their students. And reflecting on what I was saying, was schools often don't have a standardised approach. So we don't have any standardisation across schools in Wales. And the default is often to refer students to experts. And for a lot of students, that is appropriate. But for a number of students where it might be a response to challenging events in their life, it might be able to be managed in school better. And there might be a role for us to support schools within this. And one of the reflections on that then is, well, it's because students want self-harm and suicide prevention in their schools, and they want to be able to talk to their students. So mechanisms we might have for achieving that is curriculum activities, designated lessons and assemblies, and safe discussions with teachers about the behaviours and the reasons for their behaviours. So I'm just going to have a quick drink and then I'm going to move on to prevention. Okay. So I'm just going to talk a little bit now then about prevention activities and where we're trying to move to. So suicide probably has some of the strongest evidence-based approaches in terms of school-based intervention. And there's a number of different approaches which have been researched and evaluated and have been shown to be effective. A lot of these are kind of American-led, and sometimes people in the UK don't necessarily think they're appropriate for the school setting here, but these pertain to awareness and educational curriculum, so raising awareness for young people, screening of students, so getting them to take essentially sort of psychometric questionnaires to see if there are particular vulnerabilities that predict suicide, gatekeeper training. So I had been told that every secondary school in Wales would have an assist-trained staff member who would be able to start conversations with young people if they identified them as being at risk of suicide. Skills training for individuals, so that can be things around emotional literacy, social and emotional learning, resiliency, to kind of promote those earlier skills which might mitigate against these, and peer leadership models where students might support themselves. Sorry, keep pressing the wrong button. The strongest evidence I'd say we've had has come out this year. So it was published in The Lancet in January or February. And this was a large multi-country European study called Saving and Empowering Lives in Europe. So the study trialled an intervention called the Youth Aware of Mental Health Programme. So this was a manualised universal intervention. That meant it was aimed at everyone in the school. And wasn't targeted. So this included a 3-hour role play, interactive workshops, a booklet for students to take away, educational posters around the school, and lectures around mental health and just knowledge about suicide and self-harm and the risk factors. And then that was implemented by trained instructors. And actually we saw massive impacts from this intervention. So at 12 months, there was a 55% reduction in the incidence of suicide attempt, and a 50% reduction in the incidence of severe suicide ideation. So I think that's probably an indication that we're starting to get a strong sense of what to do around suicide. But the problem happens then when we come to thinking about self-harm. So at present, there are no evidence-based approaches for the evidence assessment and treatment of self-harm in schools. So research can't find any. So there's kind of development work being undertaken between Cornell University in the US and Guelph University in Canada. And in collaboration, they've developed the it's not called the Immersion Tool, sorry. It's called the Self-Injury Outreach and Support. So that's the link to the website. And that's information for young people, parents, for a whole range of professionals. And it does include information, guides and resources for school professionals as well. So kind of that'll be academic literature, stuff about risk factors, what they might do, who they might refer the individuals to. But that's not been subjected to evaluation yet. So it's much more about knowledge exchange and probably doesn't have the evidence where I could recommend it as something that could necessarily be adopted. So I think it's evident, hopefully from that we have a pretty significant research gap, even though we've clearly got a need amongst schools to be doing something. So this is hopefully where our work would come in, and where we want to try and use the School Health Research Network to try to develop intervention in this area. So some of you will be familiar with this and would have partaken in it, but if not, in 2015, it's probably more 2014, but we'll say 2015, the Children and Young People's Self-Harm and Suicide Collaboration was established, so which I led, but it was done in conjunction with other colleagues at Cardiff University, University of Bristol, University of Bath and the University of Exeter. So in the first instance, we had some funding to set up some sort of network and knowledge exchange events just to try and start scoping out this problem. And in January 2015, we held an event with Shern schools to understand their experiences of self-harm and suicidal behaviour. And self-harm was identified as the major issue that schools really wanted us to address. So our current plans at the moment and what we're undertaking is developing a grant for further funding to more extensively scope the research and intervention needs of schools. So the intention is that half of that grant will be delivered in Wales and half of it will be delivered out to southwest England from Exeter University. And it would encompass questionnaires and then focus groups with school staff. And we're probably in a slightly easier and stronger position in Wales because we've got the school environment questionnaire. So Joan will obviously talk to you about this and you will all be very familiar. But in 2016, the Shern School Environment Questionnaire will be disseminated. And we're going to move towards having supplementary sections. And the next supplementary, or the first supplementary section, will be on self-harm. And kind of based on what I've talked to you, the reason for this is that we really want to understand schools' existing prevention and intervention activities around self-harm. So in that network, away day sort of event that we had, we saw such variation in practice. So some schools actually spent their whole pupil deprivation grant on employing staff to support them. Some schools just didn't talk about self-harm at all and didn't have any activities or provisions in place. We're also then trying to gauge schools' intervention needs about, well, what types of interventions work for them, what is it that they might want, and also for our utility really is thinking about, well, what are schools' interest in taking part in future research and what might that research process look like. So that's kind of the end of our first two sections. So I don't know if we want to take a moment's pause.
Well, shall we take a moment's pause? If you'd like to open the microphones, Mike, and then if anybody wants to ask questions, I think it becomes like a hand up.
All attendees are muted and may unmute themselves by pressing star 6.
There was something just telling us that was happening. Just in terms of time, I think if you would, if you could type some questions, or if you, as I say, if you put your hands up, we can pick up on any questions. I will come back to the school environment questionnaire. We did talk about it in the summer events, and it was within the information that went out with your student survey. But it's finding out about policies and practice in schools, and it'll be one member of staff filling out one survey. But as Rhiannon said, we thought it was a great opportunity to really focus in on different health topics. So that's what we've done there. I just think, I know it's a halfway thank for Rhiannon, but actually that I found that was it was really interesting to hear all of those, and I think it just begs lots of questions that I'm sure we'll come back to either in events or through newsletters or other ways that we're communicating with you. So I don't know if anybody wants to ask questions now, or whether we perhaps will sort of move on, and we can. I think there's something coming. Is there? There's something coming.
There's a caller anonymous who's just unmuted themselves. So
right. Okay. Right. Okay. So I don't know if you've got anything you want to say. We can't identify your name through this system. No.
But that's okay.
Right.
Okay.
Well, we're sorry. Somebody was nearly going to ask a question, and I hope the technology wasn't the technology that got in the way. Rhiannon's already very kindly said that if you want to email her, and we will send contact details, obviously, to everybody, and you'll get get the presentation. I know quite a few healthy school schemes, local authorities are looking at an approach to support and help schools. So perhaps we can, I'm sure that will be very helpful, helpful to know. So just in terms of time, then maybe we'll move on, and then there'll be some time at the end if anybody else wants to ask anything. So Rhiannon is a busy woman, and there's another project that she's involved with, which has as she said, has quite a link.
Yeah, so sure. So I'll just tell you about. Oh,
yeah.
All attendees are muted.
Is that okay? Yeah, we're ready to go. Okay, so I'm just going to tell you a little bit about intervention I touched on in the introduction, which is the Wellbeing in Secondary Education project, or the WISE study. So this is a trial of an intervention to improve the mental health support and training provided to secondary school teachers. So I guess trying to think about, well, why is it that we want to focus on teachers and teachers' mental health? Well, at Decipher, we do have a general policy of trying to do more whole school approaches that are more complex in their nature and not always focused on developing the individual and the individual skills, because given the complex context of their lives, often that's not sufficient. We also need to try and tap into the context around them. And we kind of know that the mental health of teachers is pretty poor. So the prevalence of self-reported work-based stress, depression and anxiety is at a rate of 2,340 per 100,000 compared to 1,220 per 100,000 for all other occupations. So those outcomes essentially are twice as high if you work in the teaching profession. And I mean, that in itself is important, but in terms of how we relate that to what we do about children and young people is staff absence, presenteeism, and their leaving of the profession due to burnout has a significant impact on student attainment through disruption of the curriculum. But also it impacts on the relationships with students. So we have poor mental health. So it's known that poor relationships between staff and students predicts depression in students. So it's kind of a number of factors and links there which we want to work at. So this was a slide I borrowed off a colleague, kind of just documenting some of the stresses, I think, which are experienced by teachers. So the first was about self-harm and suicide in teachers as a result of the pressures of Ofsted inspections. One is kind of just thinking about the need really for teachers and them articulating through open letters the lack of support that they were receiving within their occupation. And one just from The Guardian, which says that 4 in 10 teachers quit the profession within a year because it's seen as just too difficult and challenging and stressful for them. So there's kind of an evident need then for us to try and think, well, can we intervene and do something here? So what we've developed is the WISE intervention, which has got a number of components to it. So firstly, we're trying to support staff mental health and wellbeing. And in order to do this, our aim is to train about 8% of staff in mental health first aid. So I'll tell you what that is in a minute, but a lot of you might have heard of it, or youth mental health first aid you might have heard of. And then to set up a confidential peer support service for colleagues. So these kind of models work very well in other types of interventions, but if you nominate peers who are seen as being the most influential or supportive or comforting, and they become trained in those, they can disseminate mental health messages, but also provide some support to initiate conversations with colleagues who might be seen as struggling. Then we'll train a further 7 to 8% in youth mental health first aid, and they will deliver a similar model to the students. And then just to raise an awareness kind of component to it, where everyone in the school learns about the intervention and how to utilise it, but also about mental health and wellbeing more broadly through a 1 hour session. Oh, I don't like him. So in terms of the outcome measures that we will evaluate as part of this, so the primary outcome we've got is teacher wellbeing, which I had to write down, is measured by the Warwick and Edinburgh mental wellbeing scale. But a range of secondary outcomes, which are really important for us because these kind of resonate with what schools often want more. So teacher depression through the patient health questionnaire, but also teacher absence. And actually, we kind of are in discussion about, well, what will that look like? We actually might anticipate that absences would increase during the intervention as teachers start to seek more help for their mental health. So we don't know what that would look like. Also presenteeism. So how engaged are teachers in the classroom? Because we know if they have poor mental health, they struggle to manage the classrooms and they struggle to be engaged in their job. And then there's also student wellbeing, mental health disorders for young people, but also they will have their academic attainment and their absences through routine data of the school. And then we'll look at, well, what can we learn from mental health and who uses the support service. So what does mental health actually comprise of? So it's a training course which aims to equip a person to spot the early signs of a mental health problem in others, feel confident helping someone experiencing a problem, help prevent someone from hurting themselves or others, help stop a mental illness from getting worse, help them to recover faster, guide someone towards the right support, and reduce the stigma of mental health problems. So it's very much that early intervention and prevention. We're not asking staff to deliver clinical treatment. It will be much more about supporting someone and giving them that support whilst referrals can be made on to more specialist services if need be. So in 2013 to 2014, a pilot was already conducted by our colleagues in Bristol. So they had 8 schools in the study. So 5 of them received the intervention and 3 of them were called control schools. So they didn't have the intervention. And then we compared kind of what happened in both of those. So the photograph is just the school receiving training for mental health first aid England. And you'll see at the bottom is the study website with some of the information about the study, so you can take a look at it if you want to find out a bit more. I'm thinking then, well, what were the outcomes? So essentially in a pilot study, we're trying to investigate, can we make this happen as a bigger study with more schools? Do people find it acceptable? Is it feasible? So it wasn't actually intended to assess, is this intervention effective or not in addressing wellbeing? So the outcomes are a bit more broad here. But we know that peer support has helped approximately 3 people over 2 weeks. 7.5% of staff reported receiving help, and a further 19 said that they would use it if they needed support. But I mean, the study only ran over a year, and there was a sense that it needed time to embed in the school. There were some barriers, though. Some people preferred to talk to others. They had lack of knowledge about the service, concerns about confidentiality, and about performance management. And they're not sure if they could help, if the peer could help. But these are barriers we feel we've been mainly able to address in the next stage. And these were some of the comments that people had. So I think we've done a very good job of making it more public, removing the stigma, and letting people know there is someone to talk to. Often people just really need somebody to listen to them and spend a bit of time and care over what's going on for them. And it was them effectively giving me a big hug and protecting me from it until I was ready to go back into the classroom. So quite positive feedback then about the experience. And in terms then of the perceived outcomes of the WISE study, so there was an increase in knowledge, confidence in helping others, actual help reported, and decrease in stigmatising attitudes around mental health. Sorry, there's a slight error there. Also improved knowledge, affirmed current practice, reflection on own mental health and coping strategies. So I think it's useful. Within my year team, there are people who I think are less confident and I've seen a difference in their practices. The way I listen, I think, is a bit different because of the training. You think, oh, there is someone else there who might have the same problems as I do or as other people. That was really enjoyable and really quite cathartic because we helped each other reinforce the things that we were already doing well and also perhaps consider a few other ways of approaching things. So there was a lot of good feedback then about the training. So what we're doing now is the National Institute for Health Research has funded the University of Bristol and Cardiff University to undertake a large-scale trial of the WISE project to assess, well, is this effective in addressing the outcomes that I outlined earlier? So the study hopefully will start in January 2016. And the aim is we'll start to train people in mental health first aid and start baseline surveys in September 2016 for the schools to get the data of where they're at. And it will run until December 2018. So in the study, we'll require 12 schools in England and 12 schools in Wales, so a total of 24. And in Wales, 6 schools will be intervention schools, so they'll receive mental health first aid, and 6 will be control schools. So they won't have the intervention, but they will receive all of the data, so the data will still be collected from them. So there'll be a lot of important feedback information about the mental health of their school staff and their students. So we're currently starting, we're about to start recruitment in January 2016. Still wrong button. So the thing I guess I just wanted to ask and to try out our yes or no button is, would your school like to receive more information about the WISE study? And then the other thing, which would be a type-in response, is how do you think we might encourage schools to engage in this study?
Okay.
Right, that's me done.
Oh, that's fantastic. Well, I'm slightly aware of the time, but if there are any questions, I'm just going to sort of move on and just do a very quick network news. But we can stop at any point just to ask some questions, and so we can move on from there. But we'd really like you to just say whether you would like more information. So just very quickly, just to say that we are actually recruiting schools at the moment. You may not all have been aware of that, but we've now moved from 69 up to 111 schools. We've still got a very broad free school meal entitlement numbers of schools, and we have some authorities now that have all of their schools on the network. Just to remind you, I'm sure it won't have escaped your notice that the e-survey is going on at the moment, and I know we just want to thank you really, because we've had some issues and just the way everybody's been so understanding and courteous. So thank you so much for that, and we hope that the next lead up to December the 17th will go smoothly. But as I say, always get in touch with us. The school environment questionnaire that Rhiannon mentioned, just to say that's going to be in next term, and as I say, it'll be one person who is filling that in, and obviously we'll give you lots more information on that. We're always looking for ideas and interesting and good practice and wanting to share that. Our next newsletter will be we'll be doing for the end of term, ready for the beginning of next term. So if there's anything that you're doing in terms of your reports or anything that you've done that you think would be interesting, then do let us know. just to say, certificates and logos will be sent to the new schools, and also certificates for those who joined the event. So some dates for your diary, which we have put in the newsletter, but again, just to say there will be 2 more webinars, and one in February and one in April. And on your evaluation, it's going to pop up on your screen very shortly. You've got a chance to say if there's a topic that you think, a health topic we ought to be looking at there. And we'd just love to see you. This is great at giving information, but we miss the chat, but there isn't a chat button, so we hope to see you at events in the summer. And so, as I say, we're going to do some, I've got something come up, bad network connection. I don't know what that means, but I'll just keep talking. So, as I say, there will be, there we are. There we are, an evaluation. And what I did want to point out to you is that, sorry, we've lost that. Just put it on to the next. Just one last thing, just to say that Ruth Turley, who's doing her PhD project, she wants to use the answers from the evaluation just to show how we can best share information about relevant school health research, and is webinar a good way? So your participation is entirely voluntary, and you can omit any questions you don't want to answer, and the answers will be anonymous and stored confidentiality, and it just shows there about the research ethics. So on that point, unless there are any questions, I know we've just gone just a few minutes over, but I think it's just a really interesting topic, and a very big and rather complex topic to look at. No, you were absolutely fantastic. No, you were fantastic, and that was really interesting. So if there are questions, either direct them to Gillian, me, or Cheryl, and we can pass them on. We've had, I know, somebody asking for the slides, and we will make sure that you'll get those slides sent to you.
Do that now.
In fact, Mike is going to do that now. That's absolutely perfect. So thank you so much for joining us. And yes, it's lovely we've got some very nice comments. So thank you so much. Yes, it obviously has touched a nerve, and is obviously of great interest. So thank you, Rhiannon. And we look forward to sort of seeing you again here in February. So thank you very much. Thank you.
Bye.
Bye. Are we?